Okay.
Okay, so I'm going to do these first part out of the patient's room. I'm going to be doing my 2 med checks. I'm going to be priming the medication, and I'm going to be reviewing the patient chart. So this is Sam Johnson, date of birth 18XX, no allergies, high fall risk, full code, recently admitted with dehydration and falls, past medical history, hypertension and asthma, which matches her medications of furosemide, albuterol, and acetaminophen. She lives alone at home currently, has 2 children, but they are close. Her weight is 145 pounds and her height is 5 foot 4 inches, so she's about average build. Vital signs are good. Everything else is good except for she is sore from falling. No broken bones, but she is high risk for falls. She's not up to date on her vaccines, so we're going to do that while she's staying with us. And then she has 2 medications that are due now, which is her Fluzone and her heparin. So I'm going to start with my 2 med checks first. So I'm going to start with heparin. This is for Sam Johnson. It is heparin. We're giving 5,000 units per milliliter. We're giving 5,000 units per milliliter. It is due now. We are giving this subcutaneously. This is subcutaneously, and this is to prevent blood clots. It won't get rid of any existing blood clots she currently has, but it will get rid of, or it will prevent future ones from happening. And then for the Fluzone, this is Sam Johnson. This is Fluzone. We are giving 0.5. She can give this as 0.5 since she is older than the age of 3. This is an intramuscular injection. We're giving this to help her body fight off the flu in the future if she is exposed to the virus. So it's dose, drug, it's due now. This is a Sam Johnson intramuscular injection, and so now after my first med check, I'm gonna prime these. So I'm gonna do a hand hygiene. And I'm gonna put some gloves on. So I'm gonna start with my heparin first. I'm gonna do my alcohol prep pad. I'm gonna clean the top of this for 15 seconds and let it dry, just to get any extra dirt off that could have gotten on it or dust. After 15 seconds, I'm gonna let that dry, and we're doing 1 milliliter, so I'm gonna use a 3 milliliter syringe. So I'm gonna open that up. And then I'm going to open up a blunt needle because that is what we are going to drop the medication with. I'm going to put that on there, take the cap off, put it somewhere I can easily access, and then I'm going to drop 1 milliliter of air because we are giving 1 milliliter. Okay, and then I'm going to insert that into the heparin, push the air into the heparin, and then I'm going to withdraw 1 milliliter.
And then I have here the next medication, heparin for Sam Johnson.
And then I'm going to make sure any air bubbles get out of there.
Heparin 5,000 units for 1 milliliter. That matches.
So as you can see, I have withdrawn 1 milliliter. Okay. And then I'm going to pull this back so I can make sure I get all the, and then I'm going to cap this.
And he wants this. This is a
I'm going to twist off this part, and then I'm going to be putting on this gauge needle. So since this is an intramuscular, since this is a subcutaneous injection, we are going to be given the 5/8 inch needle with the 25 gauge because we're going to put that into the fat and not the muscle. So again, clarifying that this is in fact 5/8 inch needle, and it is a 25 gauge because she is of average build, so we don't need a longer one. So I'm going to put that onto there, and then take my tape, wrap it around like this, and then I'm just going to be writing Sam Johnson, heparin.
Make sure there's no air bubbles.
I'm gonna write my initials, and then I'm gonna put the time this was prepared and date.
1 milliliter here of heparin.
And now I'm gonna do my second med check. I'm also, when I'm doing this, checking to make sure that heparin is in fact not expired. It's clear. There's no like solutes I can see. Like it looks how it's supposed to. So now that I'm gonna do my second med check, so this is heparin. It is heparin. It's for Sam Johnson. It is due now. It is given 5,000 units per 1 milliliter. This is 5,000 units per milliliter, and it is in fact 5,000 units per milliliter. It's given subcutaneously, which is why we have the 5/8 gauge and 25 gauge needle on. And then we are doing this to prevent any future blood clots from happening. Okay, so now that I've clarified that this medication is good, there's actually 1 milliliter in there. I'm gonna set this over here, and I'm gonna do my flu zone. So my flu zone, since we are giving 0.5, I'm going to be using the 1 milliliter just so I can make sure it's actually 0.5. So I'm going to put on another blunt needle. Okay. And I'm going to drop 0.5 milliliters of air, so about exactly half the syringe. And then I'm going to inject that air into this, tip it over, and then I'm going to withdraw 0.5. Making sure, using the pullback method to get all the air bubbles out. And as you can see, there is in fact 0.5 in there. So now, line up the cap, recap that. I'm going to pull that back, and then I'm going to take this off. And then I'm going to be putting on the 1-inch needle with the 25 gauge because this is for intramuscular, so we need it to go deeper than the fat. So we're going to use a longer needle, and since she is average build in size, we don't need to use a different size needle because this one will do just fine. And then I'm going to wrap this around here, and then I'm just gonna document that this is the flu zone. This is for Sam Johnson. I'm gonna write my initials and time and date when this was prepared because again, I want to make sure that it's not going to expire, which I'm also checking the bottle that it's not expired. I'm making sure it's intact. The packaging is good. I don't see any substances in there that shouldn't be. It's clear. So I have that there. So actually, I'm going to do my second flu zone check. So this is, in fact, flu zone. This is 0.5. This is given intramuscular. This is for Sam Johnson. This is due now. It's given the intramuscular route, 0.5. And this is to help her body fight off the flu if she is to be exposed to it. So now I'm going to clean up my area, and then I'm going to grab my stuff, and I'm going to go into the room. I'm going to bring the medication, some alcohol prep pads, and so a knock. Hi, Mrs. Johnson.
Hi.
Hi, I'm Regan. Let's just set that here. I want to provide patient privacy. I'm going to be giving you a couple of medications. Can I get your last name and date of birth?
Johnson 18XX.
Perfect, and I'm verifying that by checking her wristband. And now that I'm in here, I'm just going to be putting her in hygiene. And then I'm going to grab some gloves for when I'm injecting. Okay. How are you doing today?
Good.
Okay. Well, I'm here to give you your heparin and Fluzone. Can you just verify for me if you have any allergies?
I don't have any allergies.
You don't? Okay, perfect. Thank you. Now, have you had either of these medications before?
Probably, but I don't remember.
Okay, well, we will start with the heparin. So heparin, this is to prevent any future blood clots from happening. It won't dissolve any existing clots, but this will just help prevent them. A few things to note, it can cause some bleeding. So if you notice any easy bruising, nosebleeds, bleeding in the gums, just let us know, okay? Also, you might have some injection site pain. That is normal when I'm giving it, but if it's like red or swelled after, just let me know, okay? Afterwards, I would also recommend using like a softer toothbrush or an electric razor, just and avoiding any high-risk activities because you don't want to cause any extra injury because of that increased bleeding risk, okay? So, I'm going to scan your wristband. Well, let me get. Do you have any questions for me before we get started on heparin?
No.
And then I am going to scan patients.
Okay, and then I will do my last med check right here. So this is, I'm comparing it with the syringe and here. So this is in fact heparin. It is given for St. Johnson. It's 5,000 units per milliliter, given subcutaneously. We're giving this to prevent any future blood clots. There is in fact actually 1 milliliter pulled in here. So subcutaneously dose, drug, patient, time, it's due now. So we are good to give. So I'm going to press give med, and then I'm going to wait to press administer med until I'm actually administering it. So I'm just going to don some gloves. Now, before I'm just going to go over the sites of where I would give heparin. So since this is subcutaneous, I could give it in the stomach, I could give it in the thigh, I could give it in the lower back like here, I could give it in the upper back, or I could give it on the side of the arm. But I would like to give it in the abdomen, but I'm just going to clarify that. Ms. Johnson, is it alright if I inject this into your abdomen?
Yes.
Okay, perfect. So, I only have one of these, so I'm just gonna move this over. I'm gonna remove your gown and move it up. Is that okay?
Yep.
Okay, I'll try to keep you covered as best as I can. So I'm gonna put this about 2 inches above the belly button, is what we'd want to do. And now I'm going to uncap this, pull this back. I'm gonna pull back, and then watch the bubble go to the top. Perfect. And then bevel up. I'm also going to clean this first. So as I'm injecting this, you might feel a sharp pain because it is a shot. So, but it won't be very, or it will be very quick. So you just let me know if you're having a problem, okay? All right, ready? Before I just want to clarify, I'm doing this at a 45-degree angle because we're trying to get into the fat and we don't want it any deeper. This also can be given at a 90-degree angle, but since she is of average size and build, we do want to give it at that 45-degree angle. Okay, ready? 1, 2, 3. Holding the skin taut, I'm going to inject it.
Going to grab my trash, discard it.
And then I'll pull out and release the skin. All right, you doing okay?
Yep.
Okay, I'm gonna snap that on, and then immediately I'm going to put that in there.
And his bed is in the lowest position.
Okay, I'm gonna recover this. How are you doing?
Good.
Okay. And then in about 15 minutes, I'll be checking the site again, making sure that it still looks good, because right now it does. So now I'm I'm going to take off my gloves when I'm going on the computer.
Okay, it's been 15 to 30 minutes. Knock, knock, knock. How many
Administer the
minutes?
medication, since I just gave it. Okay, and now I'm gonna do the flu zone. So this is flu zone. It is for Sam Johnson. It is 0.5 milliliters. This is 0.5 milliliters. It is due now. We are giving this intramuscularly, and this is to help her body fight off the flu infection if she is exposed. So a few points I want to go over first about the flu zone. We have to give a new one every year because there's new strands of the flu. They won't actually give you the flu. It's an inactivated or killed virus. So, but it could cause some symptoms like the flu. Like if you're feeling a little fluish, you might get a little headache or sore throat. You might feel a little weak or tired. You might even give a low-grade fever. But if it progresses worse from that, please let us know. Also, if you're having any difficulty breathing, like because that can indicate an allergic reaction to the medication, please let us know for that as well, okay? It also can cause some arm soreness, especially the first 2 days after we give it. That is completely normal. So, but if it persists longer than that, you can ask your doctor, okay? So I'm going to don gloves again. Sorry. So do you have any questions for me before I administer this?
No.
Okay. I'm gonna get my gloves on. Okay. So I'm going to clean the site. I'm going to do the three, we're checking the 3 fingers underneath it. And yep. So now I'm going to clean this. Let it dry. Pull this back. See the bubble come up. There we go. And then I'm going to be giving this one at a 90-degree angle because we wanted to make sure that it gets all the way down to the muscle there. Okay, and then I'm going to be doing the Z-track method. So I'm going to pull the skin back. And then I'm going to inject this straight in. And then I'm going to inject it. And then I'm going to let go of the skin so the skin pops back. So then no bleeding will, or then the medication shouldn't just come back out. So then I'm going to immediately dispose of this. I'm going to remove my gloves. Yep, went away from me. Okay, so I'm going to administer that. Initial hit, it is documented. Okay, how are you doing?
Good.
Good? Okay, I'm just going to check your sites quick. That one looks good. And then I'm just going to lift up your gown. That one looks good still. I'm going to come back in about 15 minutes to check your sites again and also to make sure that you're not feeling any abnormal symptoms, okay? Okay, so then I would leave and come back. I'll check your sites again. Make sure that everything still looks good. Make sure there's no redness, no swelling. Make sure she's not in pain. Also, the bed doesn't go any lower. We can't, it's not lowering, but I would make sure it's low to the ground. I would make sure she's comfortable. And then I would also make sure the bed is locked. Okay.